Why do some people have a second ischemic stroke? Imagine experiencing a stroke and then wondering why it happened again. A second ischemic stroke, also called a recurrent stroke, happens because the same risk factors or underlying problems that caused the first stroke often stay or get worse if not properly managed. The main reasons include persistent or uncontrolled risk factors like high blood pressure, which is the biggest risk for both the first and second strokes. If blood pressure remains high, it can damage blood vessels and make clots more likely to block blood flow to the brain. Atrial fibrillation, an irregular heartbeat, can cause blood clots to form in the heart, which can then travel to the brain and cause another stroke. If this condition isn't treated with blood thinners or anticoagulants, the risk stays high. Smoking also plays a role because it damages blood vessels and makes clot formation more likely. People with diabetes or high cholesterol often develop atherosclerosis, which is the buildup of plaque in arteries, narrowing them and increasing stroke risk. Being overweight or leading a sedentary lifestyle can worsen these conditions, making strokes more likely to happen again. Underlying vascular disease is another big factor. Conditions like atherosclerosis and damage to small arteries in the brain, called arterial tend to persist after the first stroke. These issues make future blockages or small vessel disease more probable. If someone has narrowing of the carotid arteries in the neck, called carotid artery stenosis, plaque can break off and cause repeated embolic strokes. The type and severity of the initial stroke also matter. For example, strokes caused by blood clots from the heart, like those from atrial fibrillation, tend to have a higher chance of happening again. Smaller strokes, known as lacunar strokes, usually have a lower risk but still need attention. Age is a factor too. Older people are more likely to have a second stroke. Some studies suggest that ethnicity and race can influence recurrence, possibly because of differences in risk factor prevalence or access to health care. Not following prescribed treatments is a common reason for recurrence. If medications like aspirin, anticoagulants, blood pressure medicines, or cholesterol-lowering drugs aren't taken regularly, the risk stays high. Lifestyle habits also matter. Not making healthy changes like eating well, exercising, quitting smoking, and moderating alcohol can increase the chance of another stroke. Other health conditions can raise the risk as well. Sleep apnea, for instance, can contribute to high blood pressure and heart strain, increasing stroke risk. Having had a transient ischemic attack, which is a temporary blockage, also signals a higher chance of a full stroke happening again. Heart diseases other than atrial fibrillation may play a role but are less directly linked. To reduce the risk of having a second ischemic stroke, it's crucial to control blood pressure tightly, manage atrial fibrillation with blood thinners, stop smoking, eat a healthy diet, exercise regularly, and stick to prescribed medications. Regular checkups with healthcare providers help monitor and adjust treatments as needed. Remember, every person's situation is different, so personalized medical advice is essential. In summary, a second ischemic stroke often happens because the same risk factors and vascular issues that caused the first one remains or worsen without proper management. Preventing it involves a combination of medical treatment and lifestyle changes, always under the guidance of healthcare professionals.